Despite pleading with the national and county governments severally, issuing a number of strike notices and even actualizing some of them, the health workers fraternity has lost close to 30 of its members to COVID-19, 10 of whom are senior specialist doctors. The union officials now state that the blame squarely lies on the government.
1, Senator Mutahi Kagwe, and 2, PS Susan Mochache. Mr. President, these 2 officials have failed you, have failed healthcare workers, and have failed Kenyans.
While issuing a raft of demands directed to the national government, KMPDU officials stated that doctors have had to make numerous risks in order to offer quality health services to Kenyans, a factor they say the government has failed to notice.
Some of these doctors have had to be moved from county facilities to Nairobi. One had to die in Nakuru awaiting ICU space in Nairobi.
Despite monies being allocated to the health sector, KMPDU Acting Secretary General Dr. Chibanzi Mwachonda reveals that doctors have had to conduct fundraisers in order to settle bills for their own welfare, some amounting to 2 million Kenya shillings.
It is you who are playing politics with Kenyans' lives. We took an oath, and you equally took an oath of office. We have done our responsibility. The responsibility is now on you. If this war is not important to you, then it means our lives to us.
The National Advisory Council of KMPDU has since resolved to issue a 21-day strike notice with a view of having their grievances addressed.
We are the soldiers in this war, and if you issue orders against this notice, then that order shall be a piece of paper.
A moment of silence, please.
In a separate platform, Kenya Union of Clinical Officers officials presented similar plights, some of which contradicted sentiments issued by Ministry of Health Cabinet Secretary Mutahi Kagwe on having adequate protective gear across health facilities in the country.
They continue telling us that we have some PPE about worth 6 billion lying somewhere idle in KEMSA. What are they doing there?
You'll be surprised, the discussion around the country, that it's not about COVID anymore. It's about other priority.
The unions have now taken issue with Ministry of Health Management as well as individuals advising the president on importing Cuban doctors. Actions they warn could only lead to more of crises.
Doctors will not be sacrificed in this manner. Doctors will not engage in a suicide mission in the war against COVID-19 in Kenya.
Ben Kirera, K24, Punchline.